happy Thursday, everybody. Welcome back to the Data Science Hangout. If it's your first time joining us here today, it's so nice to meet you. I'm Rachel. Thanks for spending your Thursday with all of us. And so the Hangout is our open space to chat about data science leadership, questions you're facing, and getting to hear what's going on in the world of data across different industries. So if this is your first time here, we are here every Thursday at the same time, the same place. And if you're watching this recording on YouTube later, you can also add it to your calendar if you want to join us virtually here on Zoom as well. Curtis, I'm going to make sure that I made you a co-host so you can help me with the waiting room as people are coming in here. Okay, awesome.
Yeah, you bet.
But together, we're all dedicated to making this a welcoming environment for everybody. So we love to hear from everyone, no matter your years of experience, titles, industry, or languages even that you work in. And so every week at the Hangout, I'm joined by a different leader from the community who joins us to share their experience and answer questions from you all. So it is totally okay to just listen in if you want, but there's also 3 ways you can jump in and ask questions or provide your own perspective on certain topics. So you can raise your hand on Zoom and I'll be sure to be on the lookout here. You can put questions in the Zoom chat and put a little star next to it if it's something you want me to read out loud instead, or else I'll just call on you to jump in here and join the party. But third, we also have a Slido link where you can ask questions anonymously. And I see Hannah just shared that right as I said it. Thank you. But I'm so excited to be joined by my co-host today, Andey Nunes-Brewster. Andey is the EMS and Trauma Research Analyst at Oregon Health Authority. And Andey, I'd love to have you jump in here and introduce yourself, share a little bit about your role, and also something you like to do outside of work too.
Sure. Okay. So I've been with the Oregon Health Authority since January of 2020 in this role. I work with a team that coordinates the emergency medical services throughout the state of Oregon. And so our program licenses healthcare professionals who are first responders, including EMTs and paramedics of all shades. And we also regulate ambulance services. We have a data system for electronic patient care records for field responses, so ambulance calls that do patient care or transport a patient. Every one of those patient records is in a repository that we get. That data comes in practically real time. We have all those within 48 hours of an event. And then we also have several time-sensitive emergency registries that we manage, including trauma and cardiac arrest and stroke. Some of those have integrations with the EMS data. And one of the things I'm really excited about getting to work on is a project with the Oregon Department of Transportation, where we're looking at the feasibility of interoperability between the various EMS data sets that we have and crash data. And so that's really exciting too. And then outside of work, I do play a couple of musical instruments from time to time. That's a topic that comes up often in this space. And I have a couple of kids, one of whom is about to move into a dorm at the University of Oregon in Eugene, and we just got to take him there for a couple of orientation sessions, and I'm excited about that. He's sort of interested in data science, which I'm, crossing my fingers, but also like, go have fun and have an adventure. And then I also have a 2-year-old, or soon to be 2-year-old. So it's daycare and college at the same time for me. So I'm happy to have a permanent government position at this time. So.
You are busy.
Very busy. Yes, thanks.
Well, thank you so much, Andey, for joining us. I was thinking back to when we first got to chat one-on-one, and I think it was because you were building up your own community internally when we first got to chat one-on-one. So I'd love to learn more about that experience and what led you to start an internal group as we're waiting for questions to come in from from everybody here.
Yeah. So, and I'm correcting a couple of acronyms. You know, if I
Oh,
start
good
peppering
call.
the acronyms, I'll try to throw those in the chat too. So, yeah, our community group really arose out of a couple of sections got together: the injury and violence prevention section and the EMS folks in my program, and we wanted to do some training in R relating to kind of upskilling the team to be able to collaborate and really we were working on a procurement for POS.it, for enterprise solutions, so that we can use Connect and do more with the data that we have. And so out of this training, we ended up creating a Teams group. So our whole organization, our primary way of communicating with each other is, you know, email through Outlook and then chat through Teams. And we have lots of channels that support various working groups. And so there was a team channel that was created for that RStudio Academy cohort. And after the 10 weeks of us together, we all felt like we just wanted to share everything we had learned with everyone else. And so we opened up the group to everybody. And the first week we had, there was 8 of us to start with. We had about 6 people join in that first week when we finished and said, let's just invite everyone and let's share what we've learned. The next month there was about 40 people in that group, and by the second month we had over 100 people in that group, and that's only word of mouth. There isn't anyone running the group right now. It's all sort of like we just get together and what do people want, what do people need, what can folks bring, who can we find to help bring that. And so it's fairly organic, and we're doing a little bit of work now to try to make it a little more formal, but it's still very much a work in progress.
That's great. So it all started with those people who are
The Academy,
learning together.
yeah, the Academy cohort.
I figured it'd probably be helpful for anybody who hasn't heard of what Academy is to just explain what that process was the team went through too.
Sure. So we learned about it through the website, and then got in touch with the folks at POS.it and learned that it's 10 weeks where we get where our group is assigned a mentor, and we get some healthcare data to work with, and we go through some tutorial modules. Some of this is asynchronous, some of this we could choose to work together. It was really kind of up to the group how to manage getting through the tutorial materials. And then we would do an exercise each week where you reproduce something, right? Either a table or a way to clean the data and arrange it, or a visualization. And then from there, build on it on your own, right? To do something to expand upon that topic that week. And so our group really got a couple of things out of that experience. Sort of drops the barriers and some of the initial hesitation about sharing code with one another. And we learn how to support each other in improving code, and how to it's not just about speaking kindly, or sandwiching your critique with some positive things. Like it's more than that. It's about understanding where each other is in the learning process and really helping each other achieve our goals. And so there's a lot of learning how to listen to each other too. So that was really, I felt that was really a really great thing to come away with.
That's awesome. I bet there's something to learn from that experience too. Like you had this close-knit group of people who were already working together, who helped build this community, and that's probably helped to make it successful too. I see. Oh, sorry. You go ahead, Andy.
No, I was just going to say, and one of the references that I've been using personally and just sort of guiding my role in this is a book by it's Joss Bacon, or I could grab it real quick. It's called The Art of Community, and the author is someone from the Linux community, and so a lot of the content from this book and the approach from this book has been kind of folded into the Linux Foundation culture, and so anything that I've ever done that touches Linux Foundation work has just felt so so intentionally inclusive and just oriented in a way that I feel just really strongly to want to align with it. And so so I've been doing a little work on my own to try to steer my participation in that direction anyway.
That's great. Thank you. I'm going to jump over to some of the questions here in the chat, and I love to see the conversation happening too. Ted, I think you had a question about the group.
Yeah, I mean, well, Andy and I know each other, so hey, Andy.
Hi, Ted.
So one of the things that I've heard a lot with like starting these groups is people really want to participate, but they're so busy. Like, so I found that one of the routes to kind of improving that is to get sponsors among leadership. Do you have any experience with that?
No, that's a really interesting idea, and I'm curious about what the role of the sponsor really would be, because I would want to be able to articulate that to. I'm in my head, it sounds like kind of like mentoring, like someone who's in a leadership position that can say, go ahead and participate because we're getting this value back out of it, or something along those lines. And then folks feel like they have the space to ask for that, right?
Yeah. I think just someone who can formally say that for like, an entire group, that it's okay to spend time on this. I think also it's just people who are willing, like if your supervisor is willing for you to dedicate time to it, to organizing and things like that.
Yeah. I mean, right now, one of the things we're working on is getting leadership. And when I say leadership, I mean the Oregon Health Authority Director's Office, like our overall agency leadership is getting some support there. We've got a couple of advocates right now, but when I mean formalizing the support, like having something where someone's got a project they're working on and they're spending time supporting this community, and so that's coming from not just our folks and in public health, but that's coming from all over the agency. So I think we're heading in that direction, but the idea of sponsors sounds really interesting to me. It's also similar to where it kind of, I guess it has a different level of where in the power hierarchy that it's using, but I also like the idea of having sort of like a mentor network, right? Where I know of a few folks who are working on some things that I'm trying to learn, and also I can share back with folks who are trying to learn some of the things that I'm working on. And we've talked about, maybe ways to do something like that with the group as well. Really, it's about fostering connections and creating a culture of inclusivity where everyone can do data science. Anyone here who's working with data, whether that's language and surveys and qualitative information, or it's our quantitative epi stuff, that everyone is welcome, everyone is here to learn, we're here to support each other.
Few other questions coming in on like this learning process for your team, and I see Ben asked a question around Git. Ben, do you want to jump in here?
Yeah, we there's a lot of interest in R, but then there's this obviously backbone of application, which is Git, which I'm struggling introducing to them because a lot of the analysts and data scientists, they're not quote unquote engineers. So just curious if you addressed that hurdle, if you've seen it, and if the process you went through helped. Right.
So there's a couple of things happening with our access to Git right now. Sorry, I just bumped my chair. And we have limited access to it at this point. There's ongoing conversations between IT and data engineers and the informatics side of the house, where informatics is convincing and showing the business case that we need to be able to do DevOps. That's not been understood, by IT in the past, and so we're trying to get access to Git, and right now we can use Azure DevOps, but not many of us are. Most of us are more familiar with GitHub. So most of that learning is really focused out of all of us as state employees have access to a resource at the State of Oregon Library. It's a library that's part of the state government, and it provides resources to state agencies. And one of our resources is the O'Reilly Learning Platform. And so we can go on to O'Reilly and take any of those asynchronous courses and live courses, and we're supported in learning through that resource as well. And I've taken a handful of like Brent Laster, I think, does some Git courses through O'Reilly that have been really helpful, like just learning command line Git. But it's even the part where we're convincing folks to, you do want to spend this kind of time learning R. We have to also have the discussion about how learning is part of your productivity, right? And that if we're not learning, we're actually losing ground on building capacity for our future work, because we're not going to ever have less work to do, right? And so a lot of what we're doing is trying to find ways to be more efficient with the work that we do. But as soon as we're doing, we save, I automated this report and I saved myself, 10 hours every quarter from rerunning this report. Well, those 10 hours are like, as soon as you say that, like that time is going to another project that also really needs to get done, right? So, so we do have to say, well, even though you have that pressure, your learning is part of the productivity. And so there's time that time that you're spending there isn't just, there's meeting your learning objectives as part of, what we're here to do. And it's just as much part of your outcome, right? Or output. Any other questions on the learning? I could pivot to another one of these questions about the data, or.
Yeah, I'll handle the questions. I have the POS.it team in the background helping me.
Okay, thanks.
But I see, Alan, you had asked a question around the data landscape. Do you want to jump in here?
Yeah, sure. Hi, Andy. So like big picture, I'm super fascinated at how like I conceive of emergency services as being like this whole other like ring of service providers in the medical like landscape. And I'm curious how they interact like with you as an agency, and then like tactically, how does their data come into your landscape? And I know I'm sort of rolling on and on, but I'm really curious, like what kinds of problems are you solving with that data? Is it about like resource allocation? Is it about where people are in terms of location, like distribution of services and that kind of stuff? I realize there's a bunch there. Whatever is kind of interesting in there that you want to speak to, I'd love to hear about.
Yeah, so our program is the regulatory body. We're the regulators. Folks that provide these services are licensed through our office, and there are standards of care in place for providing those services, and we collect the data for that to be able to do quality improvement and to do compliance work. So we do compliance for ambulance services, and part of that is reviewing your records, and are you completing your patient care records? Are you appropriately checking the right boxes for particular cases? So there's, and then we also do that for trauma hospitals as well. So certified trauma centers, that data is used to verify aspects of the patient care itself, and also verify aspects of their performance improvement, because all trauma hospitals are required to have an ongoing performance improvement program. So essentially the data is used for compliance and safety, but it is also used for in the field. It can be used for decision making in patient care. So one of the problems that we've tackled recently is documentation of weight for patients who receive a weight-based medication in the field. And so this is especially important in pediatrics. And our program was able to collect data to see, you know, when there's a weight-based medication that is administered in the field, how often is the weight documented in the record? We developed a performance metric out of this, and we did a letter writing campaign to our ambulance agencies. And now our expectation was that this would be, you know, a pretty conventional thing. We'd see a 20% response rate or something super low, but it was off the chart. We went from you know, somewhere in the, you know, below our threshold to almost 100% within like a couple of months of implementing of that letter writing campaign and sharing back with everyone their performance metric and where they were compared to where we are as the state. And we're now doing multiple performance metrics. And so we do them for both EMS and trauma. A lot of that is on our website. So I hope I touched on some of that. In terms of how the data gets to us, we actually manage, we have third-party vendors who provide electronic patient care record software. And we have a vendor who provides us software for our electronic medical records systems, and then also for our licensing management system, and then also for the trauma registry. And the folks that do the EMS system also provide our stroke and care registry integrations as well. And so we do a lot of vendor management and a lot of user support between our users and things that we can do with the vendor, but things we also have to ask the vendor to do for us, you know.
Awesome. Thank you. Yeah, that touched on like a whole bunch of stuff I'm interested in. It sounds like such a neat landscape of like complex systems, and then your ability to pull like performance things out of that data and address it directly, I think is really cool. It's super neat to think about. Thanks.
Yeah, and R is really crucial to that whole workflow, because without it, you know, we're using the vendor's tools to assess how those software are performing, but that's not always even possible. And so having a way to, you know, pull data from one table, look at where things are moving into a submissions table from the other side, look at what was received on the other side. I've since joining this team, I'm learning XML and HL7 and some of these other, you know, ways of moving data between systems that, you know, it's definitely not where I thought I was headed, but it's super exciting.
I want to make sure I jump over to some of the Slido questions too. So just to remind everybody, if you joined a little bit later, you can also ask questions anonymously on Slido. But one of the, and Hannah will share that in the chat, but one of the questions there was, what kinds of governance or policies do you have for using R across your agency? So for example, deployment guidelines or software upgrade policies, approved packages.
Yeah, that is really loosely defined at the moment. At the moment, it's R is only supported at the individual desktop level, and you have to go through an exceptions process to be able to download it. And then everyone is on their own for managing their own package libraries. It's pretty, you know, incongruous in terms of being able to collaborate. You have to do a lot of your own lift to ensure that, you know, that everyone can open and run the same projects if that's what you're trying to do. And so we're really trying to work towards having an enterprise supported solution. And that's been a long haul. There's a lot of grant money that's going in to support it, but there's also bureaucracy and transparency that, you know, that we are in, that we just have processes we have to go through. And so it takes longer than we think it should sometimes, but you know, we're spending taxpayer money, and we also have grantees that we are, you know, grant funders that we have to report back to. And so, yeah, just trying to figure out how to do that. But right now it's not very coordinated.
I don't know how I'm about to ask this question. I haven't formulated it in my head, so it might come out weird.
Sure. Okay.
But I feel like you were very creative with getting around some of that to at least push things forward with being able to train new users and bring together this community. And I think it's worth talking about that too. Like you maybe hit roadblocks in one way, but went in a different direction.
Yeah, I mean, so I guess it's a matter of, I guess, accepting the things that we can control and focusing on the areas where we have some agency. And so, you know, if we're told you can't use that tool right now, you have to go through this process of approval that is, you know, 12 steps deep, and 14 different programs are going to touch that approval process. I'm kind of exaggerating here, but it's a lot, and you know, for a lot of really good reasons, a lot of legal reasons too. And at each one of these roadblocks, we just say, okay, so we're not able to move forward with this in this way now. We're going to try to keep moving in this direction. What can we do with the resources and the time that we have? And then we brainstorm a little bit and see what ideas are in the room. And then just kind of go from there. So a lot of this isn't me doing it. I'm just asking questions. And then I'm, you know, doing what I can to support folks in us, you know, following up and supporting each other.
Thank you.
And I see some of my colleagues are in here popping some comments in the chat too. So I love that some folks have been able to join and share as well. Because really, I did want to bring more of the group experience here and not just, you know, my own thing. I might share a couple of Shiny app links for some injury data just to give these folks some kudos, because the learning with them has been really awesome, and I'm really proud of the work we're doing together.
Absolutely. If you want to call anybody up here, I see Abigail, you had a question a bit earlier regarding the training piece. Do you want to ask that?
Yeah, so I've worked with the government too, and I would never suggest like don't train people because they'll leave, like that's terrible. But how do you how do you think about the attrition piece, and when you're training people in some skills that will make them able, you know, more able to leave, possibly for more money? How do you think about supporting them and what you can do to keep them after they're trained up?
That's a really good question, and I'm not a manager, so I don't really know what they do to keep people engaged, even without the learning, right? Just the fact that we're doing this work, it pays more in the private sector. Like it just does, especially for folks who want to live in Portland. Like, you know, where Portland has a higher, there's areas in the state that have a much higher cost of living than other areas in the state. And for a lot of us, we're working remotely. And so there was, you know, a lot of folks decided to move to smaller towns because the cost of living and inflation just, you know, really kind of took a lot of progress from, you know, folks in public, you know, in public sector pay in the last couple of years. So I don't really have a good answer for that. The only thing I will say is, in terms of what we can do for each other on a team, is that is creating the culture that keeps people engaged and that makes people feel like they're a part of something larger, right? And feeling connected. One of the things we hear a lot from folks in this group is, I feel like I'm the only one on my team using R, and 100 people after 2 months just is showing us that that's not really necessarily the case, that there are other people potentially using it or even wanting to learn, and we're just not able to connect with one another. And so I think having these communities is one of these ways that we can start to engage folks, but also I'm not sure that there's a really easy answer for that, because of course folks are, willing to, or, we have agency to work for whomever we want to, and public sector just has to, I don't know. I think nonprofits have a similar, a similar challenge in that, like, you want to support your people to learn and grow, and you want to keep them, and sometimes that means we have to pay them what they think they're worth. So, like, that's just a challenge of how to make that fit. Yeah, it's not a good answer, but
no, I mean, it's right. Yeah, no, it's hard. It's something we've really struggled with like software developers too.
Yeah.
It's tough to keep people. Cybersecurity, that's a big one. They just leave.
Yeah. So I don't know, maybe we start training people knowing that that if we're only supporting them in growing in skills and not supporting in everything else, that's just what's going to happen, and that you got to plan for that. I don't know. I mean, part of what keeps me here is that our organization really does focus on racial justice. We do focus on equity work. We do focus on these other pieces that make me feel like I'm contributing to the community in a way that's beyond just improving our healthcare system. And that's part of what keeps me here.
Is the quote like, what if I train them and they leave, but what if you don't and they stay?
Yeah, right.
Yeah. Let's jump over to one other question from Slido was, Oregon is known for great community responder programs. How does this impact your work?
Yeah, I think that there's a lot going on in Oregon with expanding community paramedicine and having support for behavioral health crises that isn't, the first person responding is a behavioral health specialist and not a medical provider, right? So there's some and sorry, I'm a little distracted by some of the fun comments going on in the chat.
It is really hard to not want
no,
to
it's fun. It's totally, it's all fun.
Please, I love the chat.
Please keep it coming. Yeah, and so, like, as regulators, we kind of have to be, we have to be really clear with, here's the line at which, if you're doing patient care, you have to have patient care record systems. These are the rules, right? We have to be really clear with what the rules are. And then if you're, not, if you're not providing those services, then, there's certainly ways in which our advisory groups are involved in those other groups. So, like, Mountain Rescue has a person who sits on our EMS state committee, for example. So, like, they're not necessarily an ambulance transporting agency, but they're certainly involved in a lot of different types of, events. And so, so those folks kind of get involved in our community groups. We have several, we have regional trauma advisory boards. We have a state trauma advisory board and a state EMS advisory board. We have a couple of data working groups that we run with, folks that are kind of our data super users in both EMS and trauma. And so really, in terms of community involvement, we're more of like providing information and helping connect resources, and not doing a whole lot of the community's doing the work and then coming to us and saying, hey, we're seeing this, what can we do? And we try to put together some resources and work with them.
Thank you. I see, Jared, you had a question a bit earlier about working with HIPAA data. Do you want to jump in here?
Hi, Andy. Sorry. Yeah, I think for me, it's like you speak on so many things that I've dealt with, but how do you manage to, like, on a public health level, do you talk with other states or even at a national level to, like, like collaborate on future initiatives or future endeavors where those, like, you know, when I was in my role, like HIPAA was not as much of a concern with a lot of the data we were collating and kept bringing together, but I feel like in your role it's got to be a lot more an important, like, kind of staple that may prevent collaboration from happening. So I just didn't know if you could kind of speak on how that all has kind of come into your fold and how you've managed it.
Yeah, so for the most part, our vendors are required to be compliant under a handful of things. HIPAA is just one of them, right? And there's other cybersecurity things that they have to be compliant with. And so we're very much like, it's very much part of our data governance, right? Is that we're all of our systems are compliant with those requirements. It definitely also comes into play with our fulfilling data requests. But it's, at this point, it's not so much an obstacle as just part of the framework that we're operating under. And so, you know, we have to use secure tools for doing any data sharing when we're doing our compliance work with hospitals, for example, right? And so that's, you know, I have a cybersecurity team that I call them and say, hey, this is what we're doing. Are we good? And there's either, so there's, it's a huge team effort. The HIPAA stuff is really just part of our data governance. It's just, yeah, it just seems like it's part of whatever we're doing, and I don't really have to worry about that so much as I've just got the rules, you know, the rules that I follow, and that's how that's how we operate.
Understood.
It's probably, you know, not a really great question for that, but or answer. I mean, sorry, not a great answer for your question, but the
No, it makes sense. I think it's just about knowing, like you brought up, that you have you know, like kind of a cybersecurity department that allows you to like be your conscience when it comes to sharing data and doing things like that. Because it was more of like, in my role, it was more like, if you don't feel comfortable, then don't do it. But how do you manage that to a degree when you're trying to work across multiple public health organizations to try and find some level of consistency or standardization to how you're doing things? And so then that became a bigger conversation, a bigger problem. So I just was kind of curious how Oregon, I never got that far to the coast, but I was like, I wonder how big this could be made. I know, you know, there's some governance at the national level, but could this be an okay thing of like, hey, if you're having a lot of issues in Oregon, maybe, you know, Washington or maybe California's having, you know, similar things, and you guys can kind of talk and collaborate to come up with answers, if that makes sense.
Yeah, and we certainly do that. There's so there are national standards for EMS data. I dropped a link in the chat for the NEMSIS, the organization that handles all that. There's also national data standards for trauma, and definitely, like, one of the things that I feel like I'm really good at is, like, I get to a situation where I'm like, this is something I haven't done before, and I have a sense of what I'm going to do, but I want to talk to somebody who's done this before. I have no problems going onto a bunch of websites trying to find my counterparts in other states. You know, I've connected to folks in Iowa. In fact, this weekend at the Cascadia R conference, I was able to connect with some of our counterparts at Washington, State of Washington Department of Health. And so, yeah, definitely, the data manager for my program is right now at a conference for national EMS data managers. Like, there certainly is support at a national level, and we are really trying to connect with other R users in those places, because the data does have national standards. We've got a lot of R code that, you know, works with those data dictionaries that, you know, we're using for doing things that are both human and machine readable, and we would love to share some of that with other folks that are our users. And so I'm package it. Thank you, Ted. That's my big thing that I'm working on right now, is building some internal packages, and I need to learn how to do better testing and all that. So anybody else learning that stuff right now, I'm game for study buddies.
Awesome. When I see a comment in the chat with like a ton of replies on it, I feel like that indicates it's something good we should chat about right now.
Yeah, sure.
And so Eugene, I see you had put a comment into the chat around like issues with working with certain APIs, and wondered if you wanted to like jump in here and just share what you're experiencing and see if we can maybe figure something out here as a group.
I guess what I was bringing up is the challenge of, you know, feeling alone working with R. I am totally the one-man team, 3/4 stack ML engineer, I'll call it. And I could be full stack, but we don't have a good sort of like POSIT, shiny server, enterprise solution where I could just put my stuff up there. So I'm sort of, clunking through with open source shiny server and allowing one person at a time to use my app for the one use case. But anyway, have HTTR, is a very full featured API HTTP request package. And I went through some issues trying to figure out why I was automatically being dropped by, I'm also in government, I'm a government contractor. So I'm pulling from the VA, I'm pulling from Vista, which is this monster database. And there's a few layers of abstraction between it. And we built, or I should say some people in our company built a wonderful SOAP API, standard that allows me to do multiple types of requests, and all I'm throwing in my arguments, and there's an iteration. You kind of have to do one thing to open your connection, get the cookies. You got to do another thing to follow up and select your patient, and then you got to select what you want to do with that patient or how you want to get that patient's data. And these things, depending on the time of day, it drops at night, but it doesn't drop during the day, or something with their feels shoddy. So I keep, texting back and forth. Hey, this is what I'm getting. What do you need to see to help me help you debug why this connection keeps dropping? And it just turned into, well, the people that are using this are using, Python. They're doing it with this request package. I don't know what you're doing. I don't know how it works. I don't know what HTTR is. And you have to change to a fully featured API request, type of package if I'm going to continue supporting you, period. And that, I've always had good interactions with this person until this just really broke I'm like, okay, fine, I'll do it all myself. So it was that statement. I don't know if there's the right question for how to do it, but I am building a little R Markdown report, right, where I'm going to extract every little freaking thing that HTTR can produce from the request object that comes back, and I will put it out in PDF format and hand it over and just say, please go figure out what to do. Because, I don't know what else to do from a dial point of view. I'm going to just produce technical documentation of their errors and send it right back to them and say, hey, I need help.
Feels like this is a communication collaboration piece that we've talked about through some other Hangouts at one point or another too. But I'm curious if anybody has experienced something similar or has maybe some ideas to share. And Andy, I think you were going to start with sharing something too.
No, I was just going to say I'm having I'm feeling, some of my feelings are being reflected in the chat right now. So I'll just say that. Yeah, I'm going to agree that it sounds like there's a communication piece there, a layer to that in addition to the technical aspect. If I had a question about API stuff and why something isn't working for me, I would ask Ted. Or if I couldn't Google it. So I don't have a whole lot of
Don't
experience.
make me the authority.
No, I won't. I'm just saying what would I do in this situation if I found myself struggling with an API. I guess if I found a limit where I'm finding that someone is running out of ideas for helping me work through a technical problem, I guess there's, I don't, pointing out all the things that are wrong with something someone's working on is probably not going to help them be motivated to help you fix what you're trying to do with the thing they're working on. So I try to adjust how I'm seeing it and say, okay, we're on the same team here. And we just are seeing this from a different, it's the elephant. I'm seeing the trunk only, and I'm trying to get to this other part of it, and the person doesn't see what it is that I'm seeing. And so maybe the process of doing all that documentation, you'll find something else there that you didn't see before, and then sharing that process with this other person might also open the door. I don't know.
Kind of my memory is being triggered back to a hangout with Matt Frazier when he was talking about like nonviolent communication, that book. But talking about how like when you get into this position, like listen for needs and express needs. So starting with like just explaining, I'm trying to do this for the organization. Like I'm trying to help the company. This is why I think this is valuable. Like, do you agree that this is valuable? Like taking the technical part of it, but like getting buy-in first that what you're trying to do is going to be helpful. And then saying like, in order to do that, I have these needs that aren't being met. Like, how can we get to that next step? I'll share the recording here in the chat in a second too. Harold, we'll shift gears here, but I figured because there was so much conversation there on that one, that would be a good one to dive into. If anybody had other thoughts you wanted to share there, feel free to raise your hand too. I think Abigail, you had shared a few things there.
No, I'm good. For some reason, it feels better to say you should use Python in chat than it does not in chat. I don't know.
Okay. Well, we can keep the conversation happening in chat too. But Sanjay, I saw you had asked a question about EMS and the data formats. Do you want to jump in here?
Yeah. So nationally in US, you've got a lot of data integration, obviously, across hospitals. And what I heard you saying, Andy, was that you got vendors and you got EMS systems implemented separately for each hospital or each state. Is that like that? If it is separate, then how do you integrate the data across states?
That's a really, really great question. So yes, each state implements the national state data standard in the way that they want to do it. So California, a lot of larger states that have a lot more hospitals, trauma centers than Oregon does, they tell everybody, okay, you're required to do this data. You're required to submit this data to the state. Here's the state repository. Go out and get your software and send it to us because we're the regulators, And so that's really left up to those organizations. They go and they procure software. Those vendors set up, data pipelines between the databases, and then it works, right? Supposedly. I mean, that's the idea. What ends up happening is because of requirements for data validation, and which a lot of this is built into the that software, and requirements for certain hospitals, level 1s, level 2s, and there's 4 levels of trauma accreditation, and those are based on the levels of trauma care that can be provided at those hospitals. And so everything but your level 4 is on the national level, is recommended that they provide that data to not only their state agencies, but the national database. And so those software vendors that are supporting, that provide the service to either state agencies like our program or the hospitals, they have, widgets within there that do that national data validation and submissions for national data. With the most recent version of the EMS data, there is now a data field that is a universally unique identifier for the record itself, not the patient, but the record. And that can now be linked at the national level to the trauma record. And so there's an effort now within the data standards to be able to link these at a national level. That work is ongoing. Oregon was, I think, the 7th or 9th state to adopt the new standard and start to implement this UUID, which means that our interoperability between EMS data and trauma data, we really have to focus on that. When the linkage doesn't work, that UUID doesn't move between the data systems, and we're gonna just have for this first year or two some data that isn't quite as completely linked as we want it to, but it's just a matter of improving that as we go. Oregon does provide the service, the software for all of the hospitals. They're allowed to use that for free. They can just, we provide the technical support. They can also go and get their own implementation of an integration between their hospital electronic healthcare records. A couple of our hospitals do that. And then a couple of the hospitals have their own system and export data to us. So it's a lot of different, it's kind of a lot of different ways that it happens. Yeah.
Thank you.
Yeah, thank you very much. I know that this hour goes by so quickly, but when we were talking about Academy in the beginning, I'd love to see all the great feedback that you've shared, Andy, and I was just curious, how did you feel Academy was different from other training programs that you tried?
Yeah, so the collaboration piece was big, because we were working together on a weekly basis. We were able to just form these working relationships with one another in a way that probably wouldn't have happened if we were just asynchronously doing tutorials together. And having the mentor available for answering questions, and that's also, it's not that there's someone who's like the teacher providing this content and we are taking this content in and doing a thing with it. It was almost like having a coach instead, right? And so the group was able to lean into places where we wanted to learn, and maybe it was outside of the content a little bit. And I haven't really experienced that kind of flexibility with other platforms.
When you mentioned mentor, I realized I missed a question from Ben a bit earlier too. Ben, do you want to jump in here? I think you asked about like what it meant to have a defined mentor.
Yeah, I'm sitting over here shoving my face full of chips. So.
All right.
Yeah, the mentor thing is really interesting in that it's a different role, and so I'm curious how influential it was through the process. You mentioned coach, but it really is a different aspect to it, and so I was curious how you're carrying that on, and if there is something that you're looking to in the future as you develop the community, if there is something you could clearly define to the internal team, this if you might fill that role with.
Yeah. So I guess the coach aspect of it, it just feels like there's a slightly different power dynamic than with a instructor and student. And it's like there's a little more I guess as a learner, I'm able to be a little more self-directed than like I'm here to take a class, I guess. Even though it really is focused on, here are your learning goals and stuff. As far as mentors, we haven't really had, I feel like we've sort of, rather than leaning on that one mentor that we had during that academy session, we've sort of branched out and developed a network of mentors, several of whom are just POS.it employees that are here to support us, right? And so we've asked Jeremy Allen to come and give our group a Quarto demo, and I probably could have put together a Quarto demo, but like Jeremy's just really good. So having someone come in and kind of step up to that has been really great. In terms of how we're going to support each other, I think that mentor is really just a hat that we can wear. And sometimes I'm the mentor and sometimes I'm the mentee, right? And just trying to establish the relationships where we can take those hats on and off. And I'm not required all the time to answer someone's questions, right? Like we're all here to get our work done also, right? So I think one thing we might try to do as the group is do like some computer lab, office hour, study hour kind of things where we can all show up and we can work on our own things, but then we can be there to sort of support each other and answer questions. Like that's been a thing that I thought would be fun and amazing to do. Be nice to figure out how to do that in a hybrid setting so that, folks who are living in other parts of the state and working in different programs throughout the state could still participate and learn with us. But haven't quite figured out all the logistic details on that one.
Thank
Yeah,
you.
and Jerry is awesome. I'm seeing some of that in the chat. Jeremy is awesome. Yeah.
One other slide of question I saw that just came in was, could you talk a bit more about the
Thanks,
team aspect of the work? Is the analytics in the agency centralized, or do teams get put together for specific projects?
That's a really great question. There's a little bit of both. So we have a data team in EMS, and there is also a like a health policy and analytics section in division in the agency, where they really are focused on just like data and statistics as it relates to policy and programs. But and then there's specific like analytics team and informatics teams within programs. Like our acute and communicable disease program has an analytics team where they've got a data integrator, they've got a data visualization specialist, they've got reporting specialists who build some of these dashboards, injury dashboards and things. So it's kind of a little bit of both. It's really dependent on the needs of the program and the resources that the agency has to kind of support where that work is. I think there's a couple of programs that probably really need analysts, and they're working on kind of building that capacity and stuff.
Great. Thank you so much, Andy.
Yeah.
I feel like we're like standing on stage and people are chanting for encore because I see people asking, could we have a bonus hour right now? So I know people have to drop to other meetings here. So I just want to say thank you all so much for joining us today. And thank you, Andy. I know you probably have to leave to another meeting, but I can hang around for a little bit longer if people wanted to chat too.
I just want to say thanks for this opportunity. I get so much from this group whenever I'm here, and even if I'm like, having to work on other stuff, and I'm just kind of, here to listen and learn. I just get so much from this group, and so it's just really been awesome to be able to, share back. So thank you.
I love that. Thank you so much, Andy. I can't believe how long we've been doing these now, and like just getting to actually know people through the Hangout is awesome.
Yeah, it's awesome.
Well, have a great rest of the day, everybody.
Olivia, your cat is amazing.
Okay, you need to talk so I can see your cat right now.
Oh my gosh.
I'm so sorry.
the
He has been
Oh,
he just wants every moment of my time, and he's been jumping onto my laptop and pressing keys and changing things on my screen. So
oh my
sorry,
God.
he did a lot of Zoom bombing today.
So cute. I just pinned your video so that I can only see you right now.
Thank you, Andy. Bye, guys.
Absolutely.
Bye.
Thanks, everybody.
Thanks, everyone. Have a great rest of the day.
Take care.
All right. Bye, everybody.
Bye.
Luke, I see you're still here. Did you have other things you want to chat about?
No, I was just, well, I guess my curiosity, if Andy's still around, is are there times where I know we have an issue with our regulatory body in LA County, like they have different accounting for their offload time as opposed to like ours in the EHR. So I wonder like just how you guys have kind of negotiated like when you have discrepancies depending on who's reporting what.
So like discrepancies in just like we're seeing certain records coming over and we're not seeing other records, or like actual within the record discrepancies, like the record has this over here and it's something else in this system.
The idea is more like when it comes to like patient offload times, maybe like the maybe the EMS will like start like their we arrive here time at a different point than we would in EMR. So like they're saying like, you know, the moment they like pull into the parking lot is like when they start, and maybe you're saying it's like the moment they're entered into the system or something like that. And it's kind of like how you kind of back and forth, because you know they'll be like, hey, you know, you're you know 15 or 20 minutes over the ideal, and it's like, well, not according to what we have.
Yeah, I wonder. So one of the things that we work on pretty consistently is having a demographics profile from every vendor that's participating in providing data to the EMS system. And then they're required to have their system set up under like really tight specifications for how each data element is collected and then mapped to the state registry. And we do like schema validation to ensure that, you know, the date that is shown in your record is what comes over in our record. And if it's the scene time, it's actually the scene time. If it's the, you know, transport time, it's, you know, it's, and so aside from like working with those vendors on, you know, really drilling into what information is being stored where and how that's moving from one system to another, and just really getting into those details. Like we just have to do that one vendor at a time. Sometimes it's one agency at a time, right? And we're dealing with, you know, over 200 agencies and you know, half a dozen different vendors with each a different, you know, instance in a different agency. So yeah, it's really just the data quality is just kind of seems like a never-ending source of work.
It's almost like emergencies or a giant data mess.
Yeah.
For particular reasons, like maybe the fact that they're emergencies. But yeah, there was actually one time I think we figured out that the discrepancy was because like they were not like starting their route until after their smoke break. And this is one of the private EMS companies that like drops off patients here, and we're like, so that's the issue, but it's not the issue all the time.
Yeah. Yeah. When the data's right, but you don't like what's in the data, like that's a different situation than a mapping issue.
The human element of the data. It was making me think of the Iceland, the city of Reykjavik customer story that they were like, why is this data for who's entering the different pools across Iceland not mapping up? And it was because when it got really busy, they would just open up the gates and like let everybody out. So it looked like people who entered the pools were just staying
Never
there.
left.
They never left. Yeah. All right. Well, I'm going to go eat lunch. It was nice to see everybody. Thank you so much, Andy. And thanks all for sticking around here too.
Yeah. Thanks, everyone.
Bye,
Take care.
everybody.
Bye.
Yeah.